Juneteenth is a day of reflection on the unfinished work of freedom and equity for all persons of color. My name is Leo, licensed mental health counselor, and today, as a white clinician, I'd like to use my privilege today to speak about the maternal mortality crisis happening in the United States. It's 2025, and the U.S. still has one of the highest maternal mortality rates among developed nations, especially for black women. Black women in the U.S. are 3 to 4 times more likely to die from pregnancy-related complications than white women. So how did we get here? In the early 20th century, the rise of professionalized medicine pushed black midwives, who once served their communities with cultural wisdom and care, out of the birthing room. They were labeled untrained by a medical system that racialized competence. These medical institutions became the gatekeepers of safe birth. Today, many black communities are left in medical deserts, regions with little to no access to perinatal care, OBGYNs, or trauma-informed healthcare. Add to that a healthcare system where black women's pain is often dismissed due to medical errors, and the result is a full-blown crisis. For surviving partners, especially black fathers and father figures alike, grief is often invisible. They are often overlooked, unsupported, and forced to carry immense emotional weight in silence. Research shows this contributes to complicated grief and even PTSD-like symptoms. Some studies suggest a heightened risk of mental health complications and long-term mental health decline in surviving fathers and partners. When families lose a mother, they're not just losing a parent. Children are more likely to face long-term emotional, behavioral, and academic challenges. They face disrupted attachment, poorer developmental outcomes, and increased vulnerability to mental health issues later in life. Partners often grieve alone without adequate mental health care themselves, which is compounded by systemic racism, gaps in trauma-informed care, and historic mistrust in the medical system, especially for black birthing families. And that's exactly what happened to Charles Johnson, whose wife Kira died during childbirth due to medical negligence. He founded 4Kira 4 Moms, an organization fighting for greater accountability, hospital transparency, and justice for families. Another advocate is Bruce McIntyre, who lost his partner, Amber Rose Isaac, a healthy black woman who died after being ignored during her prenatal care. He created the Save a Rose Foundation, providing education, support, and direct advocacy to change a system that too often treats black mothers as disposable. And because of their work, we now see lots of legislative changes, including the expansion of Medicaid postpartum coverage from 60 days to 12 months, increased federal funding, and multiple state-level maternal care legislation passing in states like California, New Jersey, and Illinois. But that is simply not enough. To conclude, we need broader policy changes. We need culturally responsive, trauma-informed care for black birthing families. We need higher levels of accountability within our healthcare systems. We need to make sure that no parent, no child, and no partner is left behind in silence. If this is a cause that's deeply important to you, there are at least 2 organizations today that are fighting for this cause. This Juneteenth, don't just celebrate. Look for and call out the injustices that have continued to insidiously persist in our society. And if you know someone who has silently struggled with issues highlighted here, please share this, support them, and encourage them to go to therapy.